Hi there, I'm Kate Smith and I'm a lecturer at Southlands College in Health and Social Care and in Science, and I'm going to talk to you today about the Medical and Healthcare Science T-Level. So why would you choose this course? So I imagine you'd choose it because you're interested in working in a medical area, a healthcare area and a science area. So you want to work where all of these three things join up. Now that could be in how we diagnose disorders and illnesses using science. It could be how we monitor people's health using science. So if you're interested in that kind of thing, then this could be the course for you. So you may have considered applying to study BTEC Applied Science at South Downs, and the new T-Level in Medical and Healthcare Science is replacing this course from September 21. So the T-Levels are expected to be a really big choice for students post-16 as an alternative to A-Levels and apprenticeships, and they've been developed specifically to try and meet industry need. They will offer learners a mixture of both classroom learning and industry placement. They are 2-year courses that are equivalent to A-Levels, and as such the entry requirements are 5 GCSEs or more at grade 4 or above, and that has to include English and Maths. So as you pass through this T-Level course, there are certain things that you will be learning along the way. So in the first year you'll learn some core knowledge, concepts and skills that you will need in order to then learn more about the particular occupational specialism. You will have industry placement, which in the second year will be focused on your chosen specialism, and eventually you will have your final assessments and you will qualify. So let's look and see what happens when you get to college and what will you learn about in that first year. So in the first year, the core component is all about the health and science sector itself. So what does it mean working in the health and science sector? What are the specialties that exist in the health and science sector? What are the health and safety environmental regulations that apply to the health and science sector? What does it mean to provide person-centred care when working in healthcare science? Because when you are working with diagnosis and monitoring patients' health using science, you're working with patients. Infection prevention and control in healthcare science settings is another thing that you will learn about as part of your core component. And how to manage information and data within the health and science sector. You'll learn about good scientific and clinical practice. And all of this will be assessed via an exam paper called Paper A, which lasts 2 hours and 15 minutes. Also in your first year, you will learn core component B. That's now B1, science concepts, and B2, further science concepts. And this is all assessed in exam Paper B, a 2-hour exam. You will learn some fundamental biology, including cells, tissues, microbiology, genetics, some core chemistry, chemical properties, chemical analysis, energy change, rates of reaction, and some physics, electricity, magnetism, electromagnetism, waves, particles, the kinds of things that you learn at GCSE and building on those. And then there's also further science, so there's human anatomy and physiology, genomics, diseases and disorders for biology, and there's also medical physics as well as part of your further science concept, which is very important when we learn all about nuclear medicine and magnetic resonance imaging. So another part of your first year will be the core skills. How do you put what you've learnt in core skills, core A and core B, how do you put that into context? And this will be via an employer-set project where you will be demonstrating the following skills: research skills, communication skills, teamworking skills, problem-solving skills, reporting presentation skills, and reflective evaluation. of this assessed via the employer's set project. And it's making sure that you can put your knowledge and skills that you've gained in Core A and Core B into context. So the second year is more focused on the occupational specialism itself, assisting in healthcare science. So that is the occupational specialism that we're offering at Hammond and Southdown. And in order to do this, we need to give you both knowledge and skills according to 3 different performance outcomes. And we will be using our new purpose-built clinical laboratory setting in order to equip you with the skills and knowledge that you will need to succeed on this course and to meet performance outcomes. So performance outcome 1 is all about physiological, physical, clinical engineering services and how they're used to provide reliable data and images so that healthcare professionals can use these for diagnosis and treatment. Okay. So that could be the kind of equipment used for measurements in physiological services. That means things like blood pressure, peak flow, which is how we measure someone's maximum rate of how they breathe out, and then ECG, which is how we monitor the heart. And it's also physical and clinical engineering services. As I said before, we cover things there like magnetic resonance imaging, that's MRI, but we also have X-rays and ultrasound. Okay, so there are lots of job roles that you will have to learn about as part of your knowledge for performance outcome 1, and here are some of them. As you can see, this is a very wide-ranging and diverse field to be entering into, and there are numerous job roles that you will learn about and could eventually work in. So, performance outcome 1, as well as the job roles that you've learned about, you'll also learn about the kind of equipment and devices we're using, and we talked about some of those already. How to support patients when you are collecting these measurements. There are certain things you have to do when you take the patient's blood pressure. There are certain things that patients need to know about when they are going in to have a magnetic resonance imaging scan done. You have to learn about health and safety regulations because some of this equipment is really, potentially has hazards and risks that you have to learn about in order to operate it safely. In fact, standard operating procedures themselves are very important things to learn about when you are working in any kind of health, social care and science area. You'll learn about how to control infection in those procedures. You'll learn about the systems that are used for recording service user information, and you'll learn the procedures that are used for reporting service user information. So that's performance outcome 1. Oh, not to mention urgent or immediate referrals. So when are those instances where someone needs to be immediately referred on? So after performance outcome 1 comes performance outcome 2. And this is a little bit more about the collection of a range of specimens for analysis. Okay, so now the kind of job roles, again, very wide-ranging and diverse areas of medicine that you need to learn about as part of your knowledge, performance outcome 2, but also could be jobs that you may eventually be working in. Okay, so we also need you to learn and have the knowledge about the procedures that are used for collecting specimens, the equipment and resources used in collection of patient specimens, how to handle those specimens once collected, the kinds of disease states and the collection of specimens, how they relate to each other, what to do with the equipment that's being used. The equipment that is used to collect specimens needs to be disposed of, and what is that waste stream? How to look after your stock, how to store it, and how it's monitored and controlled. And point of care testing. Point of care testing is when we test somebody, for example, in GP practice, close to or where they are actually being cared for. And after occupational specialism 2 comes performance outcome 3. after performance outcome 2 comes performance outcome 3. Now this is all about the analysis of the specimens. Okay, and again there are job roles, some of them overlap with the other specimen collection roles, but there are other new roles, so genomics and virology are more about the analysis of the specimens. Now, you will have to learn about all those different jobs that, again, you could eventually work in. Quality assurance in processing patient specimens is very important. Results have to be something that can be trusted. You will learn all about that as part of performance outcome 3. Receiving, handling and storing and disposal of samples, because obviously you will have a lot of samples that you will have analysed, and then what you've done with them then. Are they stored? Are they disposed of? That's, again, part of the knowledge you will gain as part of performance outcome 3. Then we have laboratory equipment used in the processing of specimens, and you will learn all about that, and the techniques used as well in the processing of specimens. Some of them you will have seen already, some of them you will have used already even at GCSE level. For example, chromatography. You will use similar techniques, and you will learn about similar techniques as part of performance outcome 3. So specimen details and results from specimen processing. Again, for this performance outcome, there will be a lot of data that will be produced, and that will need to be both recorded and stored. Okay, so as you can see, this is a huge field that you could be eventually working in, and as a result there are a huge range of different skilled occupations that you could move straight into after being successful on this T-level course. You may choose then to go on as an alternative to higher level apprenticeship, or you may choose to go on to higher level technical study, including higher education. So there are many diverse directions that you can go into straight from studying this T-level or further study. And I hope you found this information useful, and I hope it helps you with your decision to join us on